2017-18 was a great year of working together. We focused on a number of important projects that position us well to provide extraordinary care to our patients, their families, and our community. We began by launching our new code of behavior that's built upon 5 core values: respect, trust, commitment, compassion, and courage. Our goal is for each person who steps through the hospital doors to embrace these values through their everyday interactions and work, whether they're a patient, staff member, physician, visitor, or volunteer. We also focused on improving the patient experience. Key to this patient-centered care focus, we introduced 24/7 visiting hours for families, recognizing that they are often caregivers and key partners in patient care. We also launched the PEP program. That's our Patient Experience Participant Program. Today, PEP volunteers work with all of us, hospital staff and physicians, sharing their ideas, their perspectives, and their experiences to inform our decisions and to improve the care delivery, services, and the patient experience. You also may have noticed that we upgraded our primary communication vehicle, our website. The new site features a cleaner look and advanced search capabilities, allowing our patients and visitors to easily access the information they need. The Markham, Stouffville, and Uxbridge communities greatly supported the work of our foundations by attending events, by donating funds, and by promoting our cause to their networks. I'm proud of our accomplishments this year, and I look forward to continuing our efforts to create world-class care for our patients right here in the community.
I see a wide range of patients that come through our doors. I'm fortunate enough to greet some of our youngest patients and welcome them into the world. As well, I work with a team of professionals that ensures our elderly patients smoothly transition to the hospital for care and, when ready, seamlessly transition back into the community. Fostering partnerships is a cornerstone of the work we do at the hospital, and this year we were the first community hospital to join Kids Health Alliance, made up of leading pediatric organizations from across the province. This partnership brings the expertise of these renowned pediatric centers to our hospital and gives children the care they need in their community, where it's easier for families to visit them. And at the other end of the spectrum, the hospital opened a new clinic, Community Medicine Clinic, or CMC, in partnership with York Region Paramedic Services, as well as Home and Community Services, which was formerly known as CCAC. This clinic is part of the larger Hospital to Home program, providing elderly patients with the care services where and when they need it, preventing readmissions into the emergency department and the hospital. All of these new programs and partnerships are sponsored by dedicated staff at Markham Stouffville Hospital.
I'm honored to be at Markham Stouffville Hospital, a place where I come to work, but also a place I call my second home. In the diagnostic imaging department, I see patients and work with my colleagues in many departments and units in the hospital. I love working with so many people from across the organization who are all committed to providing great care to our patients, and I hear and feel the same sentiments day in and out. MSH has a great culture, a community feel where everyone is warm and welcoming and working towards the same goal, providing world-class care for patients right here in the community. I'm proud to be working as part of an interprofessional team who trust each other, who share the same commitment to patient care, and who display the courage to deliver on that commitment. And that team extends to both the Markham and Uxbridge sites.
This has been an exciting year for the team at the Uxbridge site. We opened our doors to patients from Port Perry after a fire damaged their hospital and their community. This meant we saw a significant increase in volumes in areas such as the emergency department and diagnostic imaging. We also responded to patient feedback and improved access to our clinics, including expanding our OTN clinic. The actual site went through a number of facility upgrades, including a new water main system, waterproofing, and repaving the parking lot. Along those same lines, the hospital also presented a pre-capital submission to the Ministry of Health and Long-Term Care for the redevelopment of the Uxbridge site. As part of future planning of healthcare services in Uxbridge, the hospital created a special board of directors committee to oversee the Uxbridge site and any future redevelopment plans. We are excited about the future of healthcare in Uxbridge, Markham, and Stouffville communities. We have all worked hard to provide the best care to our patients and their families, and we have a lot to look forward to as the plans we make today will come into fruition in the near future.
Generous support from our community makes a real impact on the lives of thousands of patients and families who rely on Markham-Stouffville Hospital each and every day. Last year, $7.4 million was raised to fund critical, life-saving equipment and innovative projects at Markham-Stouffville, including support for the Stollery Family Centre for childbirth and children, cancer services, and surgical care. We launched our Buy a Bear program to bring comforts to patients in need of a little more comfort, and we're so pleased to have provided 1,400 cuddly teddy bears to our patients. Another important source of revenue for us comes from community events hosted by individuals and local organizations committed to having a state-of-the-art hospital close to home. The government cannot fund all of the hospital's equipment and priority needs, and it's the generosity of our community that helps bring this essential equipment and inspires hope and recovery. The hospital is at the heart of a healthy community, thriving neighborhoods. It's truly incredible to witness the unwavering support from our community, our staff, our corporate partners, volunteers, friends, and neighbors. On our own, each of us has the ability to make an impact, and collectively, we have the ability to make significant and lasting change. Thank you.